If you've ever found yourself in a radiation therapy room, lying on the treatment table and looking up at the impressive machine poised above, you've likely experienced a moment of quiet contemplation. The room is often cool, the sounds are muted, and the atmosphere is one of focused calm. As the therapists make their final adjustments, a bright, sharply defined rectangle of light often illuminates the area on your body or on the couch around you. And in that moment, a very natural question might pop into your head. Whoa, that bright rectangle of light, is that it? Is that the radiation? It's a powerful, tangible presence in a process that can otherwise feel quite abstract. You can see it. You can see its precise boundaries. It feels like it's happening. It's one of the most common questions patients ask, and it stems from a perfectly logical assumption. If you're here for a treatment that uses a beam, and you see a beam of light, they must be one and the same. So, is that the radiation? It's time for a little myth-busting. The answer, in a single, reassuring word, is no. Let's be unequivocally clear about this, because it's a cornerstone of understanding the treatment process and feeling safe within it. You cannot see, feel, or smell the therapeutic radiation beam, the high-energy X-rays, or photons, that are generated by the linear accelerator to target and destroy cancer cells, are a form of ionizing radiation that exists far outside the spectrum of visible light. The beam that treats cancer is completely and utterly invisible. So if that bright shape isn't the treatment, what is that light? And why is it there? Its purpose is just as critical as the treatment beam itself, but for an entirely different reason. It's a guide, a sophisticated high-fidelity real-time map. Think of it as a stand-in or a dress rehearsal for the photons. It's a preview that allows the radiation therapists to see exactly where the invisible treatment beam will go before a single dose of radiation is ever delivered. This incredible machine, the medical linear accelerator, is a marvel of engineering. It's a big machine, capable of generating and aiming radiation with sub-millimeter accuracy, but all that power is useless without a way to precisely direct it. That's where this ingenious optical system comes into play. The machine's internal optical system is designed to perfectly mimic the path of the treatment beam. It ensures that what you see with the light is exactly what the tumor gets with the radiation. Let's trace that path. Deep inside the treatment head, after electrons are accelerated and hit a metal target, the therapeutic X-ray beam is produced. This beam would naturally travel in a straight line, emerging from the machine. First, it passes through a set of thick, heavy metal jaws, often made of tungsten. These are the primary collimators, and they move to define the general rectangular size of the treatment field, say 10 by 15 centimeters. But tumors are rarely perfect rectangles, so after the jaws, the beam passes through a multi-leaf collimator, or MLC. This is an extraordinary device, consisting of up to 160 thin, individually computer-controlled tungsten leaves. They slide into place, sculpting the beam's shape to conform precisely to the three-dimensional contours of the tumor, while shielding the healthy tissue surrounding it. Now here's the magic trick. For setup, the machine flips a mirror into the exact same path the radiation will take. This is light mode. A bright light bulb, typically a halogen lamp positioned off-axis, shines onto this mirror. Because the mirror is positioned so precisely, the reflected visible light now follows the exact same geometry. It travels down the central axis, is blocked by the same jaws, and is sculpted by the exact same MLC leaf pattern that the radiation will use. And the result is what you see on your skin, a bright outline, a perfect projection of the treatment portal. This is the light field, and it serves as the ultimate preview of the treatment, allowing therapists to verify the size, shape, and position of the field with their own eyes. But the light field is only one part of the positioning puzzle. What about those glowing red or green lines you see on the walls, the ceiling, and your body? Are those also part of the treatment? No, these are also guides. These are the room lasers, and they are used to locate a single critical point in space known as the isocenter. The isocenter is the fixed 3D pivot point around which the entire linear accelerator gantry, the couch, and the collimator all rotate. It's the geometric heart of the treatment. During your initial planning session or simulation, the radiation oncology team identifies the precise location of your tumor. They then place tiny, permanent tattoo marks or other skin marks on your body. Every single day you come in for treatment, The therapists use these lasers to align those marks perfectly, ensuring the tumor is placed exactly at the machine's isocenter. This guarantees that no matter which angle the machine rotates to, the beam will always be aimed directly at the target. You might also notice another smaller projection of light. There's also an ODI, the optical distance indicator. This is essentially a little scale of light, a ruler made of photons, projected from the treatment head. It allows the therapists to measure the source-to-skin distance, or SSD, ensuring the patient is at the correct height relative to the radiation source. This distance is critical for calculating the correct dose delivery, and the ODI provides a quick, non-contact way to verify it. So, once the therapists have used the lasers to position you, and the light field and ODI to verify the beam shape and distance, what happens next? Right before the treatment begins, the visible light turns off. Inside the machine head, the mirror that was reflecting the light moves swiftly out of the way, clearing the path. The path is now clear for the main event. The LINAC activates and delivers the prescribed dose of high-energy, invisible megavoltage photons. Still invisible. Still unfelt. The only indication that it's happening is the knowledge that the machine is on, and the quiet confidence in the team of professionals monitoring you from just outside the room. While you can't see or feel the radiation, you might hear something. A distinct buzzing or a series of clicks often accompanies the treatment. This isn't the sound of radiation itself. That's the sound of the accelerator and collimator hardware at work, the hum of the electron gun and waveguide, the whirring of motors adjusting the MLC leaves for complex treatments like IMRT or VMAT. It's important to remember this distinction. Sound is not dose. It's just the sound of the machine doing its incredibly precise mechanical work. And just as sound isn't dose, light isn't dose. The light field is a crucial safety and accuracy tool, a stand-in that makes the invisible visible for your treatment team. Dose is dose. It is a carefully calculated, precisely delivered, and independently verified quantity of therapeutic energy, and it remains completely separate from the lights and sounds you perceive. To further enhance accuracy, many modern systems add another layer of verification: onboard imaging. You may see robotic arms carrying KV X-ray panels extend from the gantry. These are used to perform a cone beam CT scan, or CBCT, right on the treatment table. This scan creates a 3D image of your internal anatomy just moments before treatment, allowing therapists to verify the tumor's position with absolute certainty. It's important to know that these are separate, very low-dose imaging steps, designed for guidance, not for therapy. They use a fraction of the energy of the main therapy beam, and just like the main beam, you won't see them either. They are yet another invisible tool in the arsenal, all working together to ensure your treatment is as safe and effective as possible.